Next on Primary Care, African American caregivers. They face higher burdens in caring for their loved ones.
I do have friends who are 100% responsible for other people, and they are just, stress maxed out.
Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care. Caregiving for someone with Alzheimer's disease is hard, and it's particularly hard if you are an African American. The data shows that African American caregivers compared to white caregivers are more likely to spend more hours caregiving, provide care to more than one family member, and report more unmet needs in terms of support and access to services. With the number of African Americans at risk for Alzheimer's disease expecting to more than double to 6.9 million people by 2030, caregivers will need more appropriate and relevant resources to deal with the oncoming tsunami. Joining us today to talk about ways to help caregivers caring for loved ones with Alzheimer's disease is Dr. Paula Duren. Dr. Duren has her PhD in counseling psychology and is the founder and president of Universal Dementia Caregivers. She started the organization after years of caring for her parents who had Alzheimer's. Dr. Duren, welcome to the show. So pleased to have you.
Thank you very much.
You are uniquely positioned to do this work. It's almost like a calling for you, so to speak. I understand that both of your parents were affected by this terrible disease.
Yes, they both were, and I feel like it's a calling. After caring and loving on them for years, I learned so much. And the challenge was I thought I was smart. And then I realized I was book smart. But then when you really start caring for someone, you realize you need to be heart smart. And as a result of that, I learned a lot and then created this nonprofit because there's so much need for caregivers. Most people care for the loved one with the disease. We care for the caregiver.
That's very true, because without the caregiver, I think we kind of lost our way in the wilderness here on this disease state, because so much is hands-on for a person who cares for an Alzheimer's patient.
Absolutely. At the early stages, not as much, but as the disease progresses, you at some point become the person that does everything for them. And I don't think people are ready for that. That transition is so massive.
Tell us about the disease itself. How are African Americans affected disproportionately by this disease?
Well, first of all, the numbers tell us and the piece that probably frightens me most is that we are the last to get a diagnosis, if we get a diagnosis at all. So we have the disease, and it's starting out sometimes, people are confused. I don't know if you remember, do you remember back in the day when we said we had Uncle Joe in the back room, and we just kind of said, oh, crazy Uncle Joe?
Yeah.
And it might have been senility. I really believe it was dementia, and we didn't know what to do with it. And what I feel and experience sometimes with people of color is that we don't realize it's a brain disease and not a mental illness. And if you're starting from that position, you treat it differently. Because in our community, we don't talk about mental illness that much. We take it to church and hope the church and the Lord can bless us to get past this mental state.
And it's going to be all right.
And it's going to be all right. And I'm a believer. I'm a believer in faith. But there are so many resources around that could help support a caregiver. So the disease is there. We really don't know what to do with it. We don't understand it. And it's so important to understand the disease and the progression of the disease. That way it prepares you to do your work.
Well, your point is well taken. For years, there were no statistics kept on African Americans in this arena. So they were always taken care of by family members.
That's right.
Nursing homes were not places necessarily for our community.
That's right.
Someone always had a room in the home, in the community, that was able to take care of them. We
Absolutely.
provide food and a little money to take care of Uncle Joe over there. So it's been around, but now it's coming into its own, so to speak, in terms of being recognized and what we need to do about it. But back to your point about the caregiver, that seems to be my struggle as a practitioner. If I don't help that caregiver, I'm really not helping that patient, because my ability to help the patient is limited.
Right.
Where do the caregivers fit in this whole thing? We know that they're very important, but help us understand something about the problems and the challenges that they face.
Well, first of all, the caregivers need to first understand the disease. Secondly, our caregivers are feeling isolated. They feel like there's a lot of stress to this disease. And when you think about Alzheimer's, they say it's the longest goodbye that you ever say, because most terminal degree diseases are, there's an endpoint, and it's normally not 10 or 15 years later. So people are struggling and focusing on the loss. So they're in pain and some levels of depression all the time. Doc, what we do is we focus on reframing that conversation. Because if you reframe it from losses to death, from losses to gifts that still exist, because all we focus on is what they're not doing, what they don't have capacity to do. And so then if you're only focused on the negative, guess what happens to my caregiver? And all the research shows us that a loved one with dementia plays off of your energy. So if your spirit is sad and depressed, guess what you're giving to that loved one with dementia who doesn't have the ability to throw it off anymore? And that's significant.
It's very true, because even just changing the surroundings,
Yes.
the room that the patient is in, sometimes is a negative effect and the outcomes in the behavior of the patient, as opposed to them seeing something that is familiar. I like your approach of saying playing off the positives, because that works for the caregiver also, to understand that there are some good things and even some good times that I can continue to enjoy
Yes.
with Dad.
And that's so important, because there's so many things that you can do to know the person is still alive. See, we forget that there's a human being in there that has the same emotional, same physical needs that you have. And I know you, and forgive me if I'm diverting too much, sometimes they say, my dad now with dementia is a dirty old man. No, he has the same physical needs, but doesn't know how to express them anymore. You and I have the capacity in our brain to say, you can't say that, don't do that, right. But they don't have it anymore. And it's so important, if we understand the disease, we wouldn't be interpreting those behaviors as negative. We would be figuring out, how do we effectively manage those behaviors?
The childhood filter becomes
yes.
the
Yes.
rate limiting thing in terms of conversation.
Absolutely.
But here again, that's something for caregivers to understand. Even the outbursts that these people
Yes.
may have that are represented sometimes in anger
Yes.
toward the son or the daughter or the nephew who's taking care of them, that is a real issue for people to understand. Look, they're really not directing it toward you.
Yes.
And that's a real problem for us to help people. We've spent a lot of time talking with families about this.
Well, we take it personal. And in taking it personal, for example, they may never have cursed at you. And for the first time in your life, your mother cursed at you. Most people are devastated, like, oh my God, they cursed at me. And I have this saying, right now, who has the healthy brain? I have a diseased brain. You are the one who supposedly has a healthy brain. Now, look at this picture. You're panic-stricken, you're upset. What about saying the issue is, that's the disease that's speaking to me right now. Let me still love on the person. But we get so tied into the emotion. And I tell my caregivers all the time, it's not about you. It's understanding that this disease is taking over, and your job is to walk me through this last journey in the most healthy manner that you can. And you have to be healthy to make it happen.
That's an excellent point. We're going to have to go to a break. Coming up on Primary Care, meet two sisters who represent a legacy of caring and caregiving.
Bye, Janet. It's nice seeing you again. You look good, girl. Just let me know what I can do to help.
Well, to help me, she'd have to help every day. Every hour, every ouch, every time my wife calls for help. I mean, maybe she could help me make her lunch, but the crust, all the crust has to be cut off the corners. She could help me run to the doctor for the 5th time this week. Help me with the specialist and the second opinions and the painful paperwork of our paperwork. Help me deal with how hard it is seeing my wife's name on so much paperwork. But this is on me. I'm the only one who can do this, like this, for her. Besides,
Take care.
we will. Janet doesn't like her cooking anyway.
Find support for your strength. Visit aarp.org/caregiving for care guides and community.
Caregiver Patricia Smiley said she and her 90-year-old sister Vera Murray were the best friends until Alzheimer's began robbing them of their shared memories. But the love and respect that they have for each other is not something Alzheimer's can easily take away.
My sister and I have been living together for 15 years, and about 5 years ago, she was diagnosed with Alzheimer's. From the time of the diagnosis, I mean, we all knew there was something wrong, but we didn't know it was as drastic as Alzheimer's. But then we knew very little about Alzheimer's. And I keep saying we, but because my daughters live with me and also my grandson and her granddaughter. Well, as a caregiver, I've learned to be more patient. I'm still not where I need to be because for a long time I was in denial. There's nothing wrong with my sister. There's no reason why she should come dressed improperly or not ready to go or not remember, those kinds of things. So I would always rush her and call her and have a little fussy tone in my voice, and I still do that sometimes. But I don't want to, I already know that there's a problem, and I don't want to make the problem worse by being a fussy person. Some of the stresses I've experienced are being able to organize and sort things out without actually doing those things. As I say, she sleeps upstairs, I sleep downstairs. I mean, that's where our bedrooms are. So she tends to come to my room for us to socialize together. And if she doesn't come to my room, or if it gets later and she hasn't come downstairs, then I'm very concerned I haven't seen her. It's 12, 1, 2 o'clock and I haven't seen her, I haven't heard her. I think anybody who's got 100 responsibility must take care of themselves, because if you don't have anybody to bounce things off with or to laugh about those things that, they seem important at the moment, but then you find out they're not really. And if you don't have somebody right there with you or somebody you can contact, quickly, because I do have friends who are 100% responsible for other people, and they are just, stress maxed out. It's important that caregivers realize that they need the reward, that they are doing work. When they're doing physical work, it's easy to identify, but when you're doing mental work and you're trying to phrase things in a way that you're not going to insult somebody or take their humanity for granted, that kind of a thing. We don't need to do that. We need to be nice, polite. The way she is to me, I need to be to her.
Without Pat being so patient and kind and putting up with me too, because sometimes I think I'm a little over anxious, and maybe I might be expecting too much of her. But she's always kind and gracious to me.
When I made the commitment to her, it wasn't a decision to say, okay, well, I got to do this. But I did make that commitment to the Lord at the same time. What I wanted to say was, my sister and I were best friends before we moved together. We saw each other every day since my mother died in 1997. And we didn't move together until 2003. So we were best friends.
Yes.
And then as she kind of started deteriorating, then the things that we shared, she didn't remember anymore. So it's like I lost my career. She was the caregiver for my mother, and she cared for her so lovingly. She set an example for all of us in that realm, as my mother did for us. So my mother took care of other people, including her father, until he died. And she took care of our mother until our mother died. But we all helped. She just made it so easy for us to come to her house where she and my mother lived and give us chores that we could do so we could all be helpful. And so even before my mother died, we saw each other often. And it was just such an honor to take care of our mother.
Yes, it was.
And it's an honor for me to care for her.
And no, you need to be upset about it, Pat. Put it together.
And I know if I didn't know the Lord, I would not know her value to me. And because of that, it's easier to make the commitment because I want to please her, but I want to please the Lord as well.
And you know your mother would be pleased that we are together. Well, we got each other.
Paula, that's a powerful piece.
Absolutely.
Tell us what you see there between these two sisters.
What you see first is love. They genuinely love each other. And I think that's the foundation for any kind of care. from anyone that's providing caregiving or support on any level of the care team. You have to love the person that you're supporting. And I know that as she moves through the conversation, she talked about just not feeling like it was real. And we all know the first stage of most of our illnesses is we deny it. We deny that it's real. But I've come to appreciate denial has purpose. It allows you not to face the sun so much, that hot sun, and until you're able to actually see. Otherwise, it'll blind you. And it just can't stay there long. You can't stay in that place long. And as they move from that, they start to accept and understand and educate themselves on the disease. What I love here is how they touch each other and connect to each other. And to me, those are all things that caregivers need to learn how to do. We focus on what they don't remember, but we all know one of our care strategies is help me remember. Help me remember is a gift that I have the ability to put music in front of you and have music connect to your spirit. I have the ability to show you scrapbooks. I have the ability to give you things to reconnect with all of the memories and love that you've forgotten, because the research shows us that that part of the brain hasn't been destroyed yet.
And what we see also is not necessarily a constant state that the Alzheimer's patient is in.
Right.
They will exhibit time periods and time frames where
Yes.
they have better days than others.
And because the disease is progressive, at the early stages you might not even know it, but they know it, and they're usually hiding it. And as it moves forward, you'll start seeing very specific kinds of behavior, like forgetting recent memories or misplacing things, and just basic elements. And then as it progresses, so there's some days I've heard people say, "My father is clowning. He does not have Alzheimer's." Well, remember that when you're in that in-between stage, you go back and forth in the process. But at some point, they're going to move that journey, and they may not be able to recall at any other past point, except for long-term memories, which are there like yesterday.
So this is caregiver education more so than anything at this point.
It's caregiver education, caregivers understanding how they impact the loved one with the disease. Because someone will say, well, my loved one was just, they holler and they fuss and they fight. And my question is, what's going on in the room? Well, they just go in the room and just start acting. Remember, these people, our loved ones still have needs for independence. It's a part of who they are. And we just walk in, touching all over them without permission, and the person starts moving and getting upset. I say, number one, calm your spirit as a caregiver. Once you're calm, you bring calm, and you can bring calm to that person that you didn't even realize. And here's an example. A family took dad out to eat, and you should never isolate them. Don't leave them at home because they may act out. Well, he decided he didn't want to keep his shirt on at the table. Do you know what people do when you start pulling your clothes off at the table? Well, the family got so panic-stricken, and they said, well, what would you have done? I said, I would have first found out what was happening for him, because he's giving me a message that something's wrong.
Something's wrong.
What they learned is he had a tag in the back of his shirt,
Irritating.
and it was irritating him, and he didn't know how to say to you, take this out. But they were more concerned with what that waitress was going to say,
And
or that
people at the
person
next
over there
table.
was going to say. It's not relevant. Most people are kind enough if you say they have dementia. It's like their whole demeanor changes with most people.
Well, we have a tag in the back of my shirt. We have to go to another break. We'll be right back. More with Dr. Paula Duren with more primary care.
We women sure know a lot of numbers by heart. But do you know the most critical numbers for your heart health? That knowledge could save your life. Do you know your numbers? Talk to your healthcare provider today to learn your health numbers. Your heart depends on it.
We are one nation, one people. When called upon to give from within, we come together and find that our capacity to help others is limitless. Here, we are fearless. What lies inside all of us is more than data. It's life. It's more than insight and medical research. It's vision and honor and compassion. What's flowing through America's veins is its diversity. The next great breakthrough will be found in each and every one of us. And what we find there will unlock mysteries, heal the sick, and eradicate disease. We ask for 1 million individuals to come forward and stand on this landmark in history. We ask America to do, once again, what she has always done: lead the way forward. We're one nation, one people, but all of us are different, and it's those very differences that will lead to answers for generations to come.
We're back with Dr. Paula Duren, founder and president of Universal Dementia Caregivers. Paula, what advice do you have for caregivers? Do you have a list of things, bullet points, some go-to items that you say, if you do this, your life is going to be better and you're going to be able to help the patient more?
I have so many lists, and yes, let's start here. One, you have to learn to control and manage yourself. Because if you manage yourself, you will then be better at caring for someone else. You need to attend to the whole person, not just their body. Because with dementia, I need to know, how's their spirit doing? How's their energy? If I'm not paying attention to that, I would miss the fact that they're interacting with the television. So the television is on, there's some murder stuff on TV, and all of a sudden my loved one is so agitated they can't sit and be comfortable. I need to observe the whole person, the whole environment. I need to also be willing to ask for help if I need help. Too many people, especially I've seen this in women who are caring for their husbands. This is my husband, I'm responsible for him. You cannot do it alone. You have to have a healthy outlet. We have a checklist that looks at social, personal, spiritual, emotional, and physical, because you have to take care of yourself too. You have to have a physical outlet in addition. And I said, have at least one healthy person in your life that you can talk to who can have a real conversation with you. So yes, we got lots of lists to help people, but the biggest thing is people need to know they deserve to be healthy.
That is something that needs to be said more often. It's not necessarily the purview of the primary care provider to have this message from A to Z. The providers need help also.
Yes.
In helping these families and these patients. What kind of recommendations or activities do you suggest that providers get involved in this disease state?
I would love it if primary care doctors would, first of all, if people have come in with the symptoms that make them think they might be dementia, that they refer them to a neurologist. Have an assessment done. I love my primary care docs, but that's not their specialty. And I think you have to move people to specialties in order for them to get the kind of help. I would like them to do mini assessments in the office. Do some kind of mini assessment to say maybe there's more to this than just general forgetting. Because not every person that's older is going to develop dementia. Some of us are just slowing down as expected. So those would be my two primary ones. And I'd say pay attention to your clients as whole people, not as somebody presenting a illness, but what else do I see there that I need to help them with, and educate them, because there's so many resources in the community for base knowledge on dementia-related diseases.
So providers need to have some go-to points of reference.
Yes.
That they can actually pass along to caregivers like we and patients like we do any other disease.
Any other
state.
disease.
And I think your point about a neurology evaluation is very well taken, because sometimes we find other problems in the workup of dementia that go unaddressed and can enhance the ability of patients to respond to the medications that we have now, which are limited. You'll be pleased to know that we've got at least 2 drugs in the pipeline that hopefully are going to give us a real step up on the treatment and preventing the progression of this disease more than we have now. Paula, thanks so much for joining us today. We'll do this again in the future. We really appreciate it.
Thank you very much.
Our guest today has been Dr. Paula Duren, founder and president of Universal Dementia Caregivers. Stay tuned. We'll be right back with some final thoughts.
Okay, Dad. 1, 2, 3.
you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
They say you don't have to be so strong, but this is my mother, my purpose. Strength is not optional. See, I lift her now like she raised me then, so I know my strength is super, but I'm still human.
Oh, look who's here.
Here's some final thoughts on dementia and caregivers. You know, society is thought to be measured by how we treat our young and how we treat our old. And I would hate for anyone to try to grade us at this particular point in time on how we're treating people who suffer from this severe disease state. Unfortunately, the age group that's being affected is decreasing. The prevalence of the disease is higher amongst certain populations like African Americans, and we aren't doing very much about it that gives us the outcomes that we need. Our society now is going to be challenged with paying more attention to a disease state in the later years of life that is going to require our attention like it has never required it before. For Primary Care, I'm Dr. Lonnie Joe.